The Health Secretary and Deputy Prime Minister spoke to GBNews Breakfast about her new health policy. This is what she had to say.
I'm covering in a variety of ways the things where patients rely most on access to the NHS, and that's actually through primary care. And that's why I've set out a clear expectation that when people phone up the surgery, first of all they get through, but also that they also can get an appointment, certainly within a fortnight, and for urgent cases, which many GPs are already brilliant at doing, getting that same day appointment so they can immediately get access to the care that they desperately need. We've had a national emergency with COVID and the NHS, and care has got us through that for people who are particularly vulnerable. That national emergency is still continuing, and it necessitates a national endeavour. And that's why we're working hard to extend some of what we did in COVID to help with probably retired staff to come back into the NHS, but also many other measures which I'll be setting out in more detail to Parliament later today.
Well, the Health Secretary and Deputy Prime Minister Therese Coffey there. Let's get some instant reaction from John McTernan, the former political secretary to Tony Blair. John, thanks for joining us in the studio. I suppose this is a big gamble of the government, putting the NHS as something that they're trying to fix in one of their first big policy blitzes. It's going to be a pretty tough winter, whatever happens.
Well, in the summer, we had the equivalent of a winter crisis, all those ambulance queues outside hospitals. In the winter, with the return of COVID, I imagine, but we'll have a winter crisis on a scale we've never seen before because there's staffing issues, and I've heard the Health Secretary concede that. But saying that you'll have access to a GP within 2 weeks doesn't make it happen. And in fact, she's clarified it's an aspiration. But the public will hear it, then they'll try and get to see their GP. They won't get to see their GP in 2 weeks. And they'll judge the government on the record, because if you put energy to one side, the next biggest crisis in the UK is the NHS. And I think I've seen nothing yet from what Liz Truss or the Deputy Prime Minister have been saying that shows that they can tackle the issue and solve it. Yes, they know it's a problem, but so do we. So do the punters, so do the patients, so do the voters. What's the solution? And I've not heard anything that suggests there's more staffing coming. There's aspiration. It's all aspiration.
Yes, I suppose one of the things that was said was this continuation of the COVID-style approach to bring some people back into the workforce who've recently retired. The health service is pretty well funded now. The NHS has more money per person than the OECD average, more than many comparable European countries. Why is it that we're not seeing the results of that investment in our outcomes?
The spending on the National Health Service has not kept up with the increase of the population of the UK. We've got a growing population. It's not kept up with the ageing of the population. We've got an ageing population. And nothing has been done to support social care, to allow social care to take some people from hospitals and put them in a care setting. And that's the difficulty of this. There has been a decade of falling investment in the health service, and that's showing it. There's been a period of slowing migration of people, doctors, nurses coming from abroad. That's showing. I
would challenge you on the idea that there's less funding per person in the NHS, because we're
the fifth richest country in the world. We shouldn't be at the average of the OECD. We should be in the top part of the OECD.
So this is
on health.
Less relative to where you'd like it to be, rather than less in absolute terms.
No, it's actually fallen. It's fallen, and it stayed real in it stayed constant in cash terms, but it's fallen because the demands on it have been growing, because our population has been growing,
ageing.
A former chief executive of the Health Service said that the funding crisis can be seen from the moon. This is a problem. There's a problem with doctors' pensions, which the government haven't solved. David Cameron and George Osborne created the problem with doctors' pensions. People are retiring early. You can't get them back if you don't fix the pension problem the way it's fixed for judges. There's just a whole set of issues which are actually to do with the satisfaction, to do with the payment, to do with the pension. The problem, though, underlying it is we don't have enough money going into the health service, and we don't have enough money going into social care. And until there's actual resources, this will just be shifting things around the system.
There's quite a lot of speculation on this question of social care.
Yeah.
This is something that has not yet been pre-briefed, but might be announced a little bit later today, this idea of trying to get people out of hospitals and into social care settings, freeing up spaces, potentially trying to alleviate the ambulance crisis that way. Is it possible?
It is possible, and health and social care should be working together, But at the moment, all the extra money in the National Insurance Levy that's meant for social care is going to the health service. People in social care are sceptical that money will come to them, and they have their own staffing crisis. There's a competition going on for staff between hospitals and care homes. You need to have an integrated approach to staffing, and I think everybody in the health service said, let's see a staffing plan. We need a staffing plan for social care. It's the interrelations at a local level, at a regional level, need to be worked through. Yes, more people could be in care homes, but they need more staff. They need fair funding. They need stable funding, and a lot of the discussion around social care from the government so far has been how do we reduce the costs, not how do we improve the quality and increase the supply. Get more supply, get higher quality, then you can help the health crisis.
Well,